So, I mean, we're going to talk about, or we can talk about anything, but the issue today is the hidden boomers, and that I have I got a job, and I have been, learning from the boomers in my job that people are in Medicare and they can't navigate the healthcare system. So I have learned that there is tremendous suffering out there. People are homebound, they can't get out. And one woman even doesn't have a hip because the doctors took out her hip and said, we can't do anything else for you. And bye-bye.
Oh no.
I'm going, okay. Oh no.
Oh, oh my gosh.
And so I'm getting a plan in place for her. And there's all kinds of situations like that. Maybe not exactly like that. Here comes Lucy.
Paula, I used to live near East Stroudsburg at one time in Minnesink Hills.
Okay, right.
All right.
I pass there all the time when I go into New Jersey.
Yeah, it's a beautiful area you live in.
You know what it really is? You don't realize it at first, but after a while, when you become more aware of things,
Yeah,
and you
Hi,
find
Lucy.
out that it's gorgeous up here.
Hi,
it
Lucy.
is. It is.
Yes, I remember coming to Minnesink Hills to visit you, Jala. And,
That's right. That's right.
and I remember it was very beautiful. Yeah.
Hello, Sid. Hi, Sid.
Hola, how are you doing?
Okay.
Good,
Each
good.
time you come on, you're a little more tan.
Well, it's pretty sunny here.
Yeah, it looks like you're enjoying a lot.
Yes,
We
Sid,
are. We got
in
back from it. Tell our daughters up near Puerto Vallarta, and we went to Chaluca, Chalala. Anyway,
Mm.
out north of Puerto Vallarta.
Uh-huh. Ah.
is
So
it,
we traveled
were you
Mexico.
mostly at the ocean?
Yes,
Mm-hmm.
good there.
It was,
I like the ocean. It's quite nice, and it's the ocean closest to where I am right now is a little rough, but we go to a different part of town, it's a little calmer.
uh-huh.
Mm.
So it's not hard to get there.
Yeah. You mean calmer and less population or?
No, no, less waves.
Oh,
It's
ocean is calmer. Okay. Yeah.
Mm.
Cool.
I've been slammed a few times. You lose your glasses, you lose, whatever else, your hat, whatever you have on. The ocean just away and you're lucky to get up.
Wow. Mm.
That's not the one I want to go to.
Yeah.
Sounds like you've been there.
I have. A while ago, not recently.
Right,
We've
right.
been 20 years.
Yeah, that's amazing.
I know.
Paula Sid
It's
is my sister.
Okay.
And well, we've known each other all of our lives. Or I've known you all of my life, but not necessarily you didn't know me all of your life. Okay. So silly, silly. Here comes Julia. Hi, Julia.
Morning, everybody.
Hello,
Hi,
Julia.
Julia. I want to introduce you to Paula, who's our new member.
Hey, Paula.
Hi, hi.
Yeah.
Paula, how did you know about this?
I think Facebook
Aha. Good.
somehow yeah.
I appreciate that
I
you're
do
here,
too.
that you're here, and um, it's the membership is, and this particular Zoom is more of a deep dive into what it is. Well, just also is it's a cafe. We call ourselves the Dear Boomers Cafe. So in many ways, it's not a heavy duty thing, but we can get into some interesting concepts and topics. Um, is there anything that you particular would like to talk about?
Not right now, no.
I wanted to say that I wanted to say that Samantha is dealing with her dog, who has gained. I probably shouldn't say it if she doesn't want to tell you. But the dog's fine, but I think it's a winter thing, and it's been very icy out here, so we can't even go out. Well, now we can. Things are melting, but he has not been outside playing ball and taking walks, and so he has gained weight. That's all.
Mhm.
I hope
So
it's
what
go
about
ahead.
it?
Say.
What can she do about it?
Well, I think they're getting some blood work.
Uh-huh.
I know with Pearl, my oldest dog, when she went to the vet though recently and she did not gain any weight. So that's good because she has Cushing's disease, and that is considered to be very common with dogs, and they do a lot of weight gain. They have a weight gain problem, and they do a lot of
Uh-huh.
shedding, but she's always done a lot of shedding. She has a huge coat. But just now, I've been able to open the back patio door, and this has been something that she's been mad at me about, knowing though that she could not operate on the ice. She knows that because she'd fall and her she's almost 15, so she's not doesn't have the strongest back legs. So, but now she can go out again, and she won't
Yeah,
go. Now
yeah.
she won't go out again. So
Oh,
the door's open and she won't go out. So
He knows better.
yeah, that's probably she knows what it was like before, and maybe he thinks that it's the same. So our animals do keep us busy, the kitty cats and the dogs and the puppies. How are your animals, Julia?
They
She,
are doing really well right now. We just had a huge storm, and so they've been it's been raining and snowing constantly, and they don't have too wild about they weren't wild about going out in the rain when it was really cold.
yeah,
yeah.
So
Blame them. Yeah.
yesterday we had a snowstorm. So it's our first and probably only snow. We might get more snow, and they're Bernese Mountain Dogs.
Yeah.
So it was kind of idyllic to see them out there prancing in the snow.
Ah,
But I'm working with them with a dog training technique called the dog calming code, and it seems to be helping a lot with BB's fearfulness. I still have to work on the getting them on leads and walking them because right now they're too afraid to leave the property. But they're getting much more calm and confident just in what we're doing, and we're feeling good about it.
good, good.
And you've got basically temperate weather there, right, Julia?
Well, yeah, it's in Northern California, it's really hot during the day in the summertime and cold at night.
Yeah.
So it's dry heat, and then in what happens in California is it rains in the winter, and then literally from like February to October, there's no rain.
Right.
So it's just this constant dry heat in the summer.
Yeah.
And where we live in the foothills, so elevation plays a huge role in what kind of precipitation we get. So we've had rain, but no, we over the last probably 10 years, we don't get snow.
Mm,
Except once a year we'll have a big storm and wreaks havoc. We were like a national disaster area about 5 years ago because we had this huge dump of snow that knocked power out
mm.
all over. Like for some people, 30, 40 days of no power and
Yes.
Really?
stuff.
Wow.
Yeah.
that's
But
Yeah.
too many
so what
days.
it really impacts us is the elevation. Like it'll be snowing up in Truckee or up in the Sierras, and then we will have warm and
Yeah.
temperate weather.
Mm.
Yeah. So our snow lasts like, maybe 4 or 5 hours, and then it'll either melt or the rain will come and melt it away. So our little snow windows nowadays are very tiny.
We sent Kirsten back to Northern California, from our trip north, and she went back, and it was snowing there on the coast in
Yeah.
Petrolia,
Mm.
and
Wow.
so worried about driving back. So she probably stayed in Arcata for a night or two. I don't know when she headed back. Well, I haven't heard yet.
Yeah, it's been a big storm, and I had wondered if it was snowing on the coast because it usually is warmer on the coast and doesn't snow.
And it's very unusual. And it
Very
did snow.
unusual. Yeah.
Yeah.
Ah,
Yes, and well, you're talking about rough roads too.
Yes.
Boulders falling off of mountains and
Yeah,
Yeah.
that happens.
Going over the coast range, up and down into valleys and up again. And it's pretty, we call it the Wildcat. It's called the
mm.
Wildcat Road.
it's best probably to
So if
let,
I want to, I
let the
have to
weather go
drive
by. Yeah,
about 9 hours, but 9 hours is better than not being able to go at all.
yeah,
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 yes.
that's right. Well, I'm glad she's making it back. Okay,
Yeah. Sonia's back too.
good. Is she back in Eugene, Oregon?
Yes.
Ted lives in
Yeah.
Oregon.
We're back. We're back in Milwaukee.
Yes,
Mm.
not in Oregon, but Sonia's
And we
back in
have
Oregon.
relatives, we have relatives here in Milwaukee, actual virtual
Ah,
relatives
Cool.
down the
ah,
street.
How did you
nice.
figure that out?
And granddaughter went to Orcas Island for a artist retreat and met a man, and they're married and have a child, and his parents live down the street from us in the winter.
Wow.
Mm.
And
That's
it's
something.
so rare that they would be in the same place we are,
I
and
know
they've been
it's
coming too.
completely
But
synchronistic.
I know we never knew them before now, or 3 years ago or so.
Well, that is wonderful. Connections and synchronicity.
Familia, right here.
I really love to think that we're all family. I know that these are tough times for that, but I think in the end, that's what we really are.
I understand that, but this is like the more direct sort of connection.
Yes, yes, it is.
We have friends here who are very much like family.
Right.
And
Mm.
ourselves family, call ourselves our people.
I guess you've known them a long time now, huh?
Yes, we have, yeah, yeah.
Yeah.
Over that 20 years, maybe 19, 18.
Wow.
That's lovely.
Well,
Yeah,
Kate
it's good.
must be doing a lot of research now with some difficult people, the people with difficult problems right now, huh?
Yeah, Kate, yeah, for
So
what
me?
you're uh facing.
Well, I really love my job. And I remember when I was a little girl, I used to play undercovers, where I had all my toys under the covers, and I would bring them out one by one to see what they needed and what I could do for them. So
Oh, wow.
in some ways, this is just an extension of my life.
Yeah, that's interesting. What a symbol, huh?
Yes,
But
That's
I,
really exactly what you're doing now.
well, I've been doing it for years, basically, but in different
Yeah,
ways. Yeah. But
yeah.
I agree, it's all a continuum, whether
right.
um the Dear Boomers YouTube channel and then the community and now this deepens my understanding of what boomers really are going through because, we, even us here and the people that are drawn to Dear Boomers are relatively healthy people. They're talking about longevity and they're talking about, eating well and moving and not falling. But these people that I am connecting with through this job as an advocate for them are even not even in their 70s. They're in their 60s. Some people are in their 50s or completely have decompressed. And
Mm,
I'm not judging them. I'm not judging anybody, but it's a tough road for them. And I'm not
yeah.
try to help them as much as I can. And it's all anybody can do, really. I'm not taking it on. I'm not trying to be a hero. I'm not trying to be a savior. I'm just basically connect some of the people I've connected with, I really feel are my friends already. And it's only been a month, so
Oh, that's lovely.
it's a good thing.
Do you have them consistently, or if people come and go?
They might come and, well, some people are hard to get a hold of, and if that continues, I don't see how we can uh continue with that. But I think that, well, let's face it, people die, so they will go. And um although that has I imagine that that will happen. And I think that in the end, when you see this medical history that is completely devastating, and when you ask them what they would like me to do, they said, I'm just lonely and I just want to talk to somebody. So I really think loneliness
Hmm.
is a common factor in our demographic.
Yes, yes.
And we're talking about profound loneliness, profound loneliness. Um,
Yeah,
Hmm.
yeah.
Hmm.
of course, there are ways to remedy that, but I don't want to be lecturing people. Yeah.
Yeah, there's an interesting, it's kind of like I think about sometimes loneliness, it's like any condition, you have to you have to participate in its cure for it to work.
Hmm.
Like, you know, um, people aren't just lonely because there's nobody to talk to. They're lonely potentially because, and I'm not saying this is a judgment or whatever, but or maybe it is, and I don't mind being judgmental. But but I think about my sister who isolates herself,
Hmm.
and then when you try to reach out, she won't respond. So that's like it's like you can't, we can't do anything about that. If my mother were alive, my mother would go to her house and knock on her door, even if she wouldn't answer, and shout through the door, Janet, I love you. And then, do whatever. But just so my mother would be like aggressive about that. But there's, what can you do if they don't respond?
Has she been like that a long time?
Well, yes, I guess so. I mean, she would isolated herself from the family decades ago. But again, like my mother wouldn't accept that and would draw her in. But she's always been a little quirky,
Yeah,
and not been popular with a lot of friends or a lot of friends, usually smaller groups of friends, but close friends that she interacted with.
yeah.
Yeah.
It's,
Reminds me
go
when I
ahead.
knew Polar.
What did you say, Sid? What?
Reminds me of somebody that I knew was bipolar.
Mm-hmm.
Well, but
Janet
sometimes she couldn't be.
doesn't have any diagnosis, mental health diagnosis,
Mhm.
but
Because she's isolated.
right, and she doesn't go to the doctor, but I
Right.
know she's depressed,
Yeah, sounds like.
for sure. Yeah.
Yeah,
Which is a mental health diagnosis.
yeah,
Well,
yeah,
right, but she hasn't been diagnosed as well, she probably has been because she's got into the social work system after an attempted suicide. So I'm sure she does have a
yeah,
diagnosis
Yeah,
somewhere.
yeah,
Just
yeah.
yeah.
And I bet she misses your mom very much.
it's really hard to say.
Okay.
It's really hard to tell.
Right, right.
It's in the back of her mind somewhere.
Well, I can't imagine that she doesn't miss someone who reached out to her no matter what she did.
Yeah.
So when
Yeah.
that's
Mhm.
my mother specifically, but I mean, how can you not miss your mother and your father? I mean, it's just biological.
Yeah.
But
Yeah.
yeah,
Yeah.
Yeah,
but her words don't line up with that kind of formal that kind of if you listen to what she says, it doesn't sound like that, you know.
How old is she?
She's 73.
Yeah. That's quite a loss for you too, to have a sister that you can't access.
It's been extremely painful.
Yeah.
When I went back last year for my brother's memorial service and I saw her, I had a big breakthrough with that, which is that, you know, for the last 15 or 20 years, I've been trying to help her
Uh-huh.
and kind of ultimately fix her. And then
Yeah.
I just realized, you know, and so there's that conflict between she's an adult, she's making her choices,
Yeah.
and who am I to say that her choices are imperfect or could be better?
Yeah.
I
Yeah.
mean, I see evidence that she has poor health and rotten teeth and,
Uh-huh.
you know, lives in a weird place. But at the same time, I've offered her financial help. We've offered her all kinds of support that she won't take.
Yeah.
So it's not for lack of offering that
Yes.
hasn't
Right, right.
come together, but she won't take it. So I finally went, okay, this is her choice. She's not
Yeah.
taking the help that's offered.
Uh-huh. Yeah.
So she's making a choice to be who she is. And so it made me be able to interact with her much more in a more balanced way. You know,
Yes.
like,
Yeah.
okay, here she is. Here's this woman who's made these choices, and she states that she's satisfied with her existence and the way things are going. And so I'll take her at face value and not try to fix that or change it or make it
Yeah.
something else. And it really helped a lot for me to, uh, I felt it was more respectful for her it was more respectful of her and her position than me thinking that I knew better for her and I
Yeah.
could fix her or help her in some kind of way. But then again, you know, I don't know if it's right or not. I just know that I feel the energy is better between us.
Oh,
Uh-huh.
that's a
Yeah.
indication.
You
That's
need to
good.
protect yourself too and let it go.
Right. And it's not like, you know, like we've literally said anything you need, you just ask and we'll make it happen. You
Uh-huh.
know, all of you
Yeah.
know, Judy and me and Dan when he was living, you know, and she just she won't even take anything. You know,
Yeah.
you send her
Mhm.
something and she'll send it back sometimes.
Oh,
Ooh.
oh my,
Yeah. Yeah.
that dear soul.
Truly.
She just wants love. You know, all anybody really wants is love. And so,
Yeah,
and then if you reject that love, you just become um, lonely, you know, really lonely.
yeah,
Hmm. Hmm. Yeah.
And that which makes me think there's all kinds of different levels of loneliness. That
Yes.
that there are uh, different. You can even be with a crowd of people or with the people that you love and still feel lonely.
absolutely. Or even more lonely.
Yeah. Yeah.
Yeah. Yes. That's
So
why.
what else are you running into there, Kate, with the people? I mean, can you direct them to social workers or people that can doctors or therapists, or will they accept that idea of
Well, yeah,
what's
because they've come to us for help and advocacy.
right?
So whatever it is, in one case, a 94-year-old woman wants a handicap, a permanent handicap placard. Well, that sounds pretty simple, but uh,
Yeah.
well, I had to buy a copier yesterday. So get the hard copy of the DMV placard thing into my hand so that we can go over. She can't fill it out herself, you know. So I will help her go through that application. And then
Uh-huh.
and then there's these logistics. And I think it's just because I'm learning the job too. How do I get her doctor to sign this hard copy? I guess I will send it to her by mail. That's
Uh-huh.
sense. I'll
Yeah.
send it to her by mail, and then We need to get it, probably fax it or send it. And she lives in Santa Monica, California, so we need to send that signed document to the DMV in Sacramento or somewhere, and somewhere. So,
Uh-huh.
um, so it sounds the logistics of these things. You need past medical records. You need to dig up what has already happened with people and then send that out to people, to the doctors, especially to say the woman who needs a hip. The
Uh-huh.
doctor needs to have all of those past surgery
Wow.
documents before they will do anything. So,
Yeah,
so
dealing with the DMV is always complicated.
I know, and I have to keep on top of it. I could space that one right out.
What
Yeah.
about the woman
I was
who's
having trouble with the prescription, and I tried to get like one way that I handle some of my medical stuff is I have them actually print like the lab never gets all of my lab work. So I have the doctor's office print all my lab work and I walk the paper in. So
Yeah.
I thought, well, maybe if you give me a paper copy of the prescription, I can go and hand it. And they go, oh, we don't have any paper
Yeah.
prescriptions anymore. You don't have they can't, they literally could not provide me with a paper prescription.
So
Oh,
okay, so here we are, the boomers. We are used to doing things like
is
Lucy,
the old
hello.
way, the old way. We're used to doing things the old way. Well, there's, for me to talk to anybody at the DMV in Santa Monica, California was ridiculous. But in the old days, we could get a hold of anybody.
oh yeah, it's hard. Yeah, that's the problem. They're not there.
They have
And there's like
Mm,
no way to contact anybody,
they have a
Yeah.
bot. They have a
like
bot or
literally no
AI.
phone numbers to get a hold of people anymore. It's all fax and support tickets through
yeah, now it's AI
web
on top.
portals.
On top of that,
Yeah.
it's AI, right? Um,
Well, sometimes
That would be a thing for Chat GPT. You could say, hey, Chat GPT, how do I talk to a person
Yeah.
at the California Department of Motor Vehicles for Santa Monica County?
I got a kick out of this. So I was trying to talking about the woman with no hip. I was trying to locate three orthopedic surgeons who would help her, um, and possibly give her a second opinion about that hip. Anyway, um, so
Is she 94? Is that what you said?
this person is 71.
Oh, okay. So she's
The
relatively young.
94-year-old also has a lot of health problems. We will tackle those later. We have to deal with the DMV first.
Yeah, yes, yeah.
Okay, so anyway,
Well, does the
anyway,
woman with that, does she doesn't have a hip? Is she immobilized?
yeah, and
Oh,
she's
wow.
completely alone.
It's
Okay, so my
unbelievable.
point is the AI that is associated with the place I work refused to give me anybody who would give her a second opinion. And they wanted me to do the research, and I said, all right, I'm not going to say it. Screw you. And I went right to ChatGPT and they gave me everything I need.
Ah,
that's good.
Yeah,
yeah.
yeah. So when they kind of act like actually they've implemented a new system with their AI, and he's sort of a smart ass. I mean, this guy, this whoever it is, this entity is a smart ass. ChatGPT can be very nice. And they know me. I've been working with them for a long time. So they came up with these three people. Now, what I have to do is make sure her health care will cover the second opinion. And that's easier than I don't really want to sit around doing research on orthopedic surgeons. That's what AI is for.
Yeah.
Yeah.
Right, right, right.
I mean, I would, but I don't want to. I don't have to. I have ChatGPT.
Is
So
that GPT or GPT?
chat GPT. Yeah, PT.
P is the other G?
I think
P T.
I think it's GPT, yeah.
What's
Yeah.
P stand for?
Oh, I don't know. Doing that isn't going to get me anywhere. I try to keep it simple.
Right.
People my age do not deal with computers. They don't do with AI. They don't.
It's generative, pre-trained transformer.
Ah,
Oh my
Oh,
God.
write that down.
I never knew what that was.
Me neither, and it never, I'm always astonished by people's curiosity.
Yeah. Yes.
I I have this client who I'm a bookkeeper and I help people with QuickBooks, and he goes, "Why does this do this?" And I go, "I don't know. It
Well,
just
that's
does it that
exactly right.
way."
That's exactly right. Now, the information you just gave us is appreciated, but I will never remember that.
Right, right.
And I don't
But it
know.
never even occurred to me to look it up. What does it stand for? I don't know. That's just a name they came up with for some reason. And
Yeah. Yeah.
Well, one of the reasons I asked is I have this Virgo husband.
uh,
Talk about Chat GPT, and he says you're not saying it right. I said, well, what's the right way to say it? And then he doesn't tell me. And I think if there's another way to say it, please tell me. Is it GBT or GPT or what is it anyway? And he goes, please let me alone. So
Oh,
I
well, obviously he doesn't know. So
he
that's
does.
he's being
I don't
that.
know why he thinks I said it wrong. I said, you know what I'm talking about. Why? He said, just say chat. That's enough. Okay. He's
I mean,
probably annoyed by the whole thing.
he probably doesn't deal with it at all. Chat.
That's true.
Yeah.
No, he doesn't. I ask it questions, and run into a lot of cultural things here. So I ask questions about the other
Sure.
cultures, and it gives me good answers.
Oh, okay. It does.
Mm.
Yeah.
It does. Um, I think the AI problems with expanding data banks and squeezing out people and raising electrical prices and costs is a big problem. And it's going rampant and it really should not. It really everybody has an AI associated with their situation. And in my, in this platform I work with at this new job has their own AI. Well, they're not always telling me what I need to know, so I go to another AI. There's all kinds of AI, but to me,
Wow.
that's unnecessary, I think, um, and harmful to the environment, and also it's raising electrical costs like crazy.
Yeah, yeah, right, right.
Maybe we should just go back to the good old days when we could talk to each other.
Well, I remember thinking about all the changes that our parents went through in the uh, decade. That's not the right word. In this, like the last century, how
Yeah,
they began their life in the beginning of the century, and all
Yeah.
these different things
Yeah.
happened that were in that century. And I guess we're going through the same thing, changes in our century.
Yeah.
yeah,
And
that's right.
I
That's right.
think trying to do it the way we've always done it won't work anyway. So we've got to somehow figure out how to do it the way it is
Yeah,
yeah,
going.
like around this time in the 1920s would have been the transition from horses to cars.
Right.
That was a
Exactly.
big one. Yeah.
Yeah, so that
Right.
was like
Right.
that was huge. So that was like changed. It changed everything about everything. We
yeah,
have
Right.
highways, we have towns, we have new
That-
industries. You've got
right.
tourism, you've got restaurants, you've got hotels, which you
Yeah.
didn't have before in the same way. So it's changing everything. The thing that
Yes.
just terrifies me the most is like, watching is the generational impact of social media, TikTok and all of that and what it's spawning in terms of our youth. And it
Uh-huh.
literally, looks like all of these like apocalyptic movies like The Hunger Games and I mean Clockwork Orange and all of that. It's like literally like when you see these characters that have been raised on a diet of social media that's been curated by them. You see people that just don't have, they just are so uh they're not well rounded. Like they don't think, I don't see them thinking with discernment. And not that everybody does already any now, but it's just
Yeah.
like I don't know. That to me is the thing that I see is the most challenging thing, is like people who have been now raised on this diet of I guess though everybody always has been raised on narrow diets based on their home, their culture, their town, their politics, their religion. So most people are, as children, raised on narrow diets,
Yeah,
like
yeah.
and I mean like intellectual diets, not food diets.
Yeah.
Hmm.
Like in terms of the what you consume mentally and emotionally and spiritually, and
Yeah.
then it's when you would go to school or university or have a reason to travel that would like open you up mentally, emotionally, and spiritually to others and change the way you think and walk in the world. And
Yeah.
I see the focus now is that people are really working on being exactly who they are, no matter where they go.
Uh,
And and
yeah.
that is and then imposing that on everything they see, as opposed to looking at it as an opportunity for connection.
And
Yeah.
expansion.
There's a lot
Expansion.
of that.
Yeah, which I guess is, again, we're looking at, colonialism coming back into the world,
Yeah.
and everything being viewed just as, what is it that you got that I want, and
Right. Right.
give it to me or I'll take it from you.
Hmm.
And I don't know. So that's what I find, more so than the technology and all that. It's more the way younger people seem to think and move in the world, and they don't have any interest in like politics or trying to take ownership of stuff. They just want to have their little narrow world,
Hmm.
like an iceberg.
And we see that here because people come into Mexico in these little towns with big money and they build big things. And they
Mm.
do, I mean, there's a real issue right now, and I won't go into what it is, but they take the privilege that they have because of the money and they just overstep their boundaries, as we see our president doing.
Yeah.
And then things in zones that are not possible to be built in. And then they run into legal problems and then they try to buy their way out of it. But
Yeah.
got a culture here that says, fuck you, go away. And we're gonna, and if they don't do what they're supposed to do with these rules, they will be, they could be assassinated.
Wow.
Everybody will look back.
Are you talking about Mexico politicians?
Yeah, no. I'm talking about people coming into this country from
Oh,
other countries with a bunch of
Yeah.
and building things in zones that are not legal,
yeah.
Uh-huh. Yeah.
and then maybe trying to buy their way out of it. But there's also then the, yes, the government, or Claudia, for instance, who says, no. But not just her. I mean, the government won't bend to that money.
And you're saying that somewhere the Mexican culture will just remove that threat. We'll just go in and take them out.
Yeah.
Yeah,
Okay.
because they're being bad guests.
That's, we could look at the, yeah, bad guests.
Yeah.
Well,
Right.
And
And rich people from America and maybe Europe and stuff don't think that could happen to them.
in Canada too.
And Canadians, right? Yeah. But you think that you always think that Canadians are
You would
nice.
think so.
More
would be
gen
nicer.
more,
You would though, right?
yeah,
Huh?
more genteel.
They're better than many, but they're still there.
They're still there. They still have ugly money. Huh?
They do.
So,
They do.
so Paula, what part of the country are you from?
The East Coast, Pennsylvania.
Oh, you're a Pennsylvania person too. Yeah. I live in California, but I lived in Lancaster for
Oh,
many
okay.
years. Yeah.
Yes.
I originally, what's interesting, I was born in Allentown, it's
Hmm.
Pennsylvania, and my parents were in the bakery business. And at that time, the goal was once you accomplish a great bakery, you sell it and you move on to some other place to make another great bakery.
Uh-huh.
So what happened was I was born in Allentown and really never thought about it and lived in New Jersey most of the time.
Mhm.
And came out to Pennsylvania about maybe 18 years ago. And is what I like about Pennsylvania is that it's, for me at least, it's quiet and there isn't as much traffic, even though it's gotten busier. But
Yeah.
as soon as I get on Route 80, you can tell the traffic's all over and it's noisy. So on one hand, I like it. The other hand is that it takes a while to get to anything. Like if I
Mm.
want to go to a store, it's going to take me 20 minutes. Okay. Um, but for aging, on one hand, I think it's good because you can let your guard down. You don't have to keep up with the Joneses. You do what you want, and nobody bothers you. And so I like it for that. But educationally, there's a whole nother ballgame. Uh, the people don't know certain things that I found very common. Everybody should know these certain people. Like everybody should know Dr. Phil. But of course, everybody does. But like I took workshops with Iyanla Van Zant or Iyanla, who was also like a Dr. Phil. And out here, nobody knows who she is. So it like surprises me, you know.
Yeah.
Tony Robbins, nobody out here really knows who he is. It's
Mhm.
just certain things that surprise me. And also, they're backwards on a lot of stuff in that the driver's licenses are still paper. There's certain things. And when I'm in a diner or a restaurant, I can always tell who's from out of state.
Hmm.
Yeah.
Yeah.
Yeah. That's interesting.
Yeah. I find out here, uh, at least in my area, the men seem to be extremely tall, which I find amazing. I think it's nice. Uh, Most of the women are, I won't say thin, I won't say skinny, I would say medium plus excess. That's how I can tell when somebody from another state comes in, because they're dressed differently, okay? And
Mhm.
they're a whole lot thinner. But I don't care. I like it here. That's my point.
Yeah. Yeah.
Yeah.
I can I think a lot of people around here are no longer from here. They have come from New York, New Jersey, maybe even West Coast. So it used to be when we were young, everybody was from here. That's another change.
Yes, it is.
Um, and so it's always good to, like you said, you just got in touch with one of our neighborhood friends. That's a good thing to, John Earl, to get in touch
Oh,
with him.
yeah.
It's
Yeah.
awesome. He was also our brother's best friend growing up, but he came from a very conservative family, and that did not, my family was very, I'm telling you, Paula, everybody else knows, was very liberal and very outspoken. So, but nevertheless, John Earl was drawn to us and our
Yeah.
family.
Had an impact on him. That had he admits, he says that had impact on him that was positive.
Hmm.
He liked Kitty's books and Kitty's way of thinking, I think. Kitty is our
He
mother.
did.
Yeah.
And when Kitty thought,
What's that?
that's more than way of thinking. She did. She was a thinker, and I'm not sure that he grew up with thinkers.
Well, very
I mean,
few people do.
what?
Very few people do.
That's true. I think that his family just went along to get along and didn't question things much.
Well, I was just describing our upbringing to somebody else recently. We had this open door policy. My mother loved books. She was a thinker. She had books lined up throughout the whole wall of a very large living room. And she had an open door policy so that people would come in at any time, have coffee around Christmas times, Christmas cookies. She was a maniac for baking Christmas.
Yeah, yeah.
Yeah,
And
yeah.
and that was an unusual thing because that does not happen anymore. Nobody comes around unless you invite them. And even then, they may not show up. That's
I
what,
have I have a friend here who also grew up that way, that anybody could come in anytime. And when she said it to me, you can come over anytime. I like looked at her. I don't get it, because I'm not used to it. But on occasion I've done it. But I don't like doing that because who knows what they're doing? Maybe they're taking a bath or something.
yeah, exactly.
Well, that happened to our mother. She was in the bathtub, and the little boy next door came in and came up and went into to the room, and she was in the bathtub. And I don't know that happened after that exactly, but she found it quite amusing that, and his name was Stuart, I think. So I know that much. Stuart came in and asked her what she was doing. I mean, he just accepted that she was in the bathtub.
Yeah,
I'm not sure
she was
that.
not modest either,
She wasn't, no.
which is unusual for her age. Or she was very, whatever, her generation, I should say.
Yeah, yeah.
Oh, I think it's very interesting to talk about our upbringings in relationship to what's going on right now. That could be another topic for another day.
Yeah.
But I have to go. I have another patient,
So,
and I have a patient two
okay.
at 2. So, I mean, I loved having everybody here. It was great to meet you, Paula. And
Thank you.
we do this every
Yes,
other
yeah.
Friday at 1 o'clock Eastern time. And we can do it in 2 weeks, which do not know the date right now. Let's see. Oh, it must be March.
Yeah, it is.
Wow. Yeah.
Yeah. We go back to Oregon about March 24th.
Oh, nice. Springtime, hopefully.
Here,
Yeah. Yes.
But
another
I'm very happy that
time.
you're all here.
Yeah.
And
We could go.
I'm sorry. What's that?
Take care, everyone. Take care.
Yeah, yes. Goodbye,
Okay.
Lucy.
Bye.
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 Julia,
Bye.
maybe we should wait a minute for her. And we can say, well, I'd hate for her to come back and have us not be here, but maybe that doesn't matter.
Oh, here I am.
She is. So we love you, Julia. I have a patient at 2, so we're gonna
Right, so you gotta go.
gotta
Yeah,
go.
I had a dog. The dog was choking on something, so I had to
Oh
go.
my God.
Figure out how to,
Gonna
not
do
really choking, but I threw my first dog toy away. They say after they break them down a certain point, you have to throw them out. So I have one that's now in the trash.
you have to put
Oh,
CPR on the dog.
Yes, no, yeah, not yet, just a little.
Okay. Okay,
okay.
love you all. Love you.
Bye.
Yes. Goodbye. Good.
Bye.
Adios.
Love you
Bye.
all.
Welcome, Paula. Thank you for coming.
Yes.
Bye.
Bye.
Bye bye. Love to all.
Bye-bye.